All right, we're going to get started. So good afternoon, everybody. Welcome to today's webinar, Building a Stronger Support, Ensuring WIC Participants Talk to the Same Nutritionist. We record all of our live webinars and store them on demand for folks to view later if they could not make it to the live recording. All the resources we share throughout today's training, including a copy of the PowerPoint slides, will be made available with a recorded version of the on-demand webinar on the on-demand webinar page of the New York State WIC Resource Hub in a few business days. Just as a reminder, you must be registered for today's webinar in order to attend. If you have not registered through the hub, you will be not able to access the evaluation and receive your certificate. New York State DOH policy is that anybody who misses 15 minutes of the webinar will be removed and asked to review the recorded webinar at another time. The Zoom doors will close 15 minutes after the start of today's webinar, and no one will be permitted to enter after that time. Just as a reminder that CEI, we support breastfeeding. If you're nursing and need to step away to pump, please chat the producer to make them aware. It's important that you inform the producer or trainers that you are taking a break to pump so that you're allowed back into training. I'd like to introduce myself first. My name is Deb Bonzo. I'm a registered dietitian. I've been with CEI as a senior trainer for about 2.5 years. If you have not met me before, prior to coming to CEI, I was with a local agency in upstate New York, and I spent 34 years in a WIC clinic, both as a nutritionist, as a site supervisor, outreach coordinator, and finally spent the last couple of years as the WIC coordinator. I'm so excited to be joined by Abby Pierce today. I'm going to have Abby introduce herself.
Hi, everyone. My name's Abby. I'm a registered dietitian, and I'm currently a public health nutritionist in the Central Regional Office. I started as a qualified nutritionist and then a nutrition coordinator with a local agency in Watertown from North Country Family Health Center.
Great. Thank you, Abby. And so we also have two producers here today. We have Kelly and Kat. So if you're having any technical difficulties, please reach out to them and they're going to be there to help you. I want to give you a little bit of background of CEI. If you're not familiar with CEI, CEI is a nonprofit organization with over 40 years of experience working at the local, state, and national and international levels to help organizations improve healthcare and social services for historically marginalized communities. We do this by providing high quality education, training, research, and technical assistance services to organizations servicing diverse communities. Some of the projects include sexual and reproductive health, maternal and child health, sexual violence prevention, HIV and STI, substance use, mental health, tobacco use, to give you some examples of the scope and range of our work. And of course, currently we are contracted with the New York State WIC as the WIC Training Center. CEI's mission is to use the transformative power of education and research to foster a more aware, healthy, compassionate, and equitable world. At CEI, we believe WIC has the power to change lives. We have nothing to disclose today. This training was developed through a collaborative relationship with New York State Department of Health WIC program and Ciccatelli Associates. Funding for this training was provided by the United States Department of Agriculture. And here is the contact information for both the New York State Department of Health and CEI or Ciccatelli. This slide indicates that all policy information we will be discussing today is derived from the United States Department of Agriculture and the New York State laws and regulations. Everything we discussed today comes from policy documents that are available in the NIWIC library. Today's training goal is to empower WIC program staff and nutritionists with knowledge, strategies, and tools to establish consistency and trusting relationships with participants through continuity of care. By emphasizing the importance of participants talking with the same nutritionist regularly, we can enhance participant engagement, improve health outcomes, and increase overall satisfactions with the WIC program. Our training objectives or learning objectives will be to define continuity of care as it applies to WIC, discuss the benefits of maintaining consistent relationships with nutritionists and participants, identify strategies to strengthen continuity of care for WIC clients, address common challenges and purpose-effective solutions, reimagine scheduling process to enhance the consistent provision of care in the WIC program. We're going to get started today with a poll question. I'm going to have Kat launch a poll for us to answer. And how often do participants talk with the same nutritionist at your agency? And your choices are rarely, never, rarely, sometimes, or always. Almost 50% of you are saying sometimes. Sometimes the participants get to talk with the same nutritionist, which I think is great. And then another 31% of you said often or always. So that's really great, and this is what we're talking about today. We actually have another poll question for you. And we're curious, how important is it for you to talk to the same healthcare provider for routine care? Very, somewhat, not very, not at all. 62% of you said it was very important for you. And then another 38% said somewhat. Anybody feel like they would love to unmute and tell us why? Why is it important? What's that benefit for you? And it's okay if you would not, but we'd love to hear from one of you. Why is it important? Go ahead.
For me, it's because you want to make sure that the person that you're speaking with knows you, and you don't want to keep on repeating the same thing over and over.
Mm-hmm. Yeah, absolutely. You said it really well. You want to make sure that person knows you, and you don't want to have to repeat yourself, right? Nobody wants to have to do that. Great. This is what we're talking about today. So you can see how important it is for you all. You know that it's important for your participants too.
But you know what? Sometimes it's hard and difficult because sometimes nutritionists are out sick, they're on vacation, so you don't always get the same nutritionist.
No, you don't always?
Or the same nutrition assistant.
Yep.
So, you can't always count on, okay, I want to speak to Joanne, or I want to speak to Eddie, because they could, like I said, they could be out sick on vacation. So you have to trust other people to do the same job as they would if they were there in their place.
Absolutely. And we're going to give you some helpful hints throughout today's webinar how to deal with those situations. So great. So let's talk about understanding continuity of care and WIC. So this was our definition for this webinar. Continuity of care refers to the practice of participants talking with the same nutritionist across multiple visits, fostering relationships, trust, and improved health outcomes. This approach facilitates the development of strong, ongoing relationships, allowing for better monitoring of progress and more personalized guidance. Let's continue to explore the importance of continuity of care on the following slides. So building strong relationships and trust. Continuity of care is critical for building a strong relationship between the participant and their nutritionist. Talking with the same nutritionist regularly fosters trust, comfort, open communication, leading to better adherence of the recommendations. There's accuracy and tracking of the progress. Consistent visits with the same nutritionist enables better tracking of the progress and more personalized interventions. The nutritionist gains a deeper understanding of that participant's unique circumstances, challenges, and improvements, allowing for more targeted and effective interventions. With consistent monitoring, it helps in better addressing the needs of the participant and the ability to adjust plans as necessary. It also allows for personalized and tailored care when the nutritionist knows the participant's history, preferences, and specific needs. They can offer more personalized advice. This approach ensures that guidance is impactful and addresses individuals' needs rather than offering that generic advice that's sometimes given. It increases trust and open communication. Repeated interactions with the same nutritionist builds rapport and trust, which is critical for open and effective communications. So it enhances the trust and enhances the communication. When participants trust their nutritionist, they're more likely to share important information about their habits, their concerns, challenges, which leads to more effective care and better health outcomes. Improved health outcomes. Continuity of care can lead to better health outcomes as the participants are more likely to consistently follow the nutrition recommendations. This approach may result in improved maternal and child health, better overall nutrition, and then reduce the risk of chronic diseases. The ongoing relationship helps ensure participants remain committed to their goals. Enhanced program satisfaction engagement. Understanding and support leads to participants' increased satisfaction with the program, which increases engagement, adherence to guidance, fostering long-term health and program success. So this was sort of the overall benefits of continuity of care within the WIC agency. I'm going to pass it on to Abby. We're going to now hear about the benefits of continuity of care for participants and the benefits of continuity of care for that nutritionist.
Okay. So the first benefit of continuity of care for our participants are improved health outcomes. Participants who talk with the same nutritionist regularly develop trust, leading to better adherence to dietary recommendations and leading to better health results. Personalized nutrition advice. Nutritionists who are familiar with a participant's history can provide more customized advice that feels more relevant and effective to the participant. This continuity also reduces the need for participants to repeatedly explain their history and ensures a smoother experience. Enhanced participant satisfaction. Participants feel valued and understood, and this leads to higher satisfaction with their WIC services. And lastly, improved engagement. Ongoing relationships encourage participants to stay committed to their health goals, attend scheduled appointments, and actively participate in their health goals. So next we'll look at the benefits of continuity of care for the nutritionist. The first one is a better understanding of participant needs. Continuity allows nutritionists to develop a deep understanding of each participant's unique needs, preferences, and challenges. Reduce need for repetition. Familiarity with a participant's history means less time repeating information and allows more time for impactful interventions. This also leads to more effective interventions tailored to the participant's evolving needs. Enhance job satisfaction. Building long-term relationships with participants leads to more rewarding and fulfilling work experiences for the nutritionist. And lastly, less burnout. A strong rapport with participants and reduced repetition may help create a more manageable workload. This helps to reduce stress and help prevent burnout. And so I'll pass it back to Deb so we can talk about key strategies on how to establish continuity of care at your agency.
Deb, you're on mute.
Thank you. So let's talk about strategies. I think that's one of the main reasons many of you are attending is, how do you do this? So let's talk about how to get established in your agencies. So first, the schedule in NIWIC needs to support continuity of care. We want to assign a nutritionist to align in NIWIC to facilitate consistent scheduling and seeing the same participant. And some examples of ways you could do that, you could assign your nutritionist Debbie to line 1, or you could rename a line in NIWIC Debbie's line or Deb. Okay, so those are 2 different ways to do that. There also needs to be flexibility in scheduling. You need to create scheduling policies that are flexible and allow for participants' preference, while also aiming to ensure consistency. So we want to give participants that option if they want to see someone different, right? We need strong communications with participants. We need to inform participants who their nutritionist is. We want to provide participants with direct contact information to foster a greater sense of personal care. We want to ensure that our participants know how to contact their nutritionist. And then we want to enhance communication between staff. We want to improve communications between the nutritionist and the scheduling staff to effectively manage planned or unplanned absences or delays. We want to ensure documentation in NIWIC and notes. We want to make sure that notes contain the essential information to ensure the next nutritionist can maintain continuity of care. We want to ensure all documentation is complete and clear. This promotes continuity of care that allows the routine QN to know what was previously discussed, and also provides support to the QN that may need to cover in the absence of another QN. So those notes in NIWIC need to be complete and clear. We are also recommending that training and guidance be provided for the staff. We want to provide training sessions for all staff on the benefits and strategies of continuity of care. We really believe that all staff need to be involved in this model. We want to have a method for monitoring and feedback. We want to use feedback and regular reviews to monitor the effectiveness of continuity of care practices and make necessary adjustments as they occur. We also think that you could start small and scale up. You don't have to do this for everybody in your agency. So some ideas that have come up would be begin with new participants or high-risk participants. Start with a few nutritionists, or if you have multiple locations, maybe you start at just one of your WIC sites. You should set alerts for the assigned nutritionist in NIWIC. So that's a great thing to put in alerts who that participant has been assigned to. Missed certification appointments should be rescheduled with their assigned nutritionist. And nutritionists should contact the participants who missed their nutrition education and or their health and nutrition update appointments. So we're recommending that nutritionist handles their own no-shows. We want staff to be comfortable reaching out to participants and letting them know that the regular nutrition is not available and politely offering another nutritionist. High-risk participants should talk with a qualified nutritionist that day. And high-risk participants must be scheduled with a QN for recertification appointments. So we want to weave that into our practice. We also want to empower nutritionists to manage their schedule and their own appointments. If they need time off, they could be in charge of rescheduling the participants on their line. All right, I want to show you a video montage. We're going to hear directly from some nutritionists about how it's been to have a caseload and consistently see the same nutritionist. This video montage is from the 2022 to 2023 learning community. So I want you to hear from some nutritionists that have been doing this.
I always try to make that known at the beginning of the first appointment together that I'll be the nutritionist that they'll be working with here on out, as long as they want to keep speaking with me, as long as they still have an active certification, just to keep them comfortable with what's going on, that they're knowledgeable of what to expect at the future appointments, that they understand that we're going to keep following up on goals that we talked about at the last appointment.
It is a satisfaction because you can kind of see the progress that is going on. Well, before that might not be the case, but now you can see the progress and you can see whether or not to continue with the same approach or things need to be changed. But in my experience, it's good to see how things that you suggest are being implemented and you do feel like you're making a little bit impact.
It's been pretty good to see how they grow, even if we see them like in short intervals of time. It's been pretty cool. It's been great. It's actually very satisfying to see both sides, even when they haven't made so much progress, how they come back to you and they're willing to be open and to help, like to search for the help, and it's the same person, and to have that connection, and keep on working towards a specific goal.
I've noticed that the relationship is stronger between those participants that I have seen before. So the trust is there, and they are more likely to open up a little bit more regarding their health information. It feels great.
We're building these relationships with participants and we're helping them set goals. And then we're actually there to see them achieve their goals in the future appointments too. And we can really congratulate them and praise them and help them understand, like we started from here and now we're here. Like, look at how far we've come.
Oh my goodness, it makes me feel great because that means what I'm saying, what I'm doing is actually working. Now, if I see that the advice or the commitment that we agree on doing is not working, I know I have to geared towards something else. I have to ask more questions. Why is not that working?
I feel that not just myself has to stay consistent with the implementation part of it, but the whole team has to be on board as well. So I believe teamwork is very important in continuity of care.
But I think it really does pay off in the long run. It's hard to see from the first appointment and the second follow-up any real change at that point. But once you get to like the fourth meeting or the fifth meeting, you know, you really do see their progress over time. And I feel like you're more willing to want to help them with future things and really dive into additional questions or problems that they have. So then they understand that you're their point of contact too. So when they call into the office for a question, they're asking for Abby, their nutritionist, to help them with something.
You can see that what you're doing is not forgotten, and you can see the progress basically. So that's the main thing. And of course the fact that you're actually providing a better quality service to the participant, because you know you're more in touch with the situation, since we've been dealing with it from before.
I'm getting excellent feedback from the participants. They're saying that it's excellent that I'm calling them back. They don't have to repeat the same information over and over again. So it's like that consistency follow-up with them, and they're very grateful. Be kind, be gentle, and be open to as many questions as they're going to be asking you, and try to write notes. That's the most important thing. When you're open to listen what the participant is saying, you're gonna get good things from them. They're gonna open up to you a lot more.
At the end, it's a participant center, so we should be focusing on what their needs are and how to increase a positive outcome.
I just love that video. When the 2022 to 2003 learning community set out to do this, we knew that the participants would love this, but we were blown away by the impact it made for the nutritionist staff. So that was really a kind of aha for us, is that how valued this was for the nutritionist. I have a couple more testimonials that I want to read to you. This one was from Kately. It does help when they have a complicated situation. It's easier to pick up from a complicated appointment that I saw last time. After reading the notes, I usually remember the family, and it makes assessing easier and helps with overall rapport. And the family won't have to open up and share their whole story with a new person, and I can pick up right where I left off. Wow, that's great, right? This is from Rosetta. I love being able to work with the same family to follow their progress and support their goals. It's nice on our end to be able to comfortably go into the appointment knowing their background and the journey, and pick up where I left off or where we left off. So I'm going to give Abby a few minutes to talk to you about her experience. I know you saw her on the video, but Abby had been doing continuity of care as a nutritionist with North Country Family Health for several years, and I really would love for her just to talk to you about her experience.
Thanks, Deb. So, like Deb had mentioned, I started as a QN with North Country Family Health Center in 2021. So I had been doing appointments on my own for about a year by the time we joined the learning community in 2022 to do the continuity of care model and building our own caseload. So just to give a little bit of backstory on the agency I was coming from, North Country is a dual county agency with just under like 4,000 participants, and we had 3 permanent sites. So our largest perm site had about 5 nutritionists, 3 QNs, 2 CPAs. We had one perm site with about one QN, one CPA, and our smallest site was one QN and one part-time CPA. So like we had talked about in some of the earlier slides, it kind of happened naturally at one point because our permanent sites, some of them were so small that they didn't really have a choice. Those nutritionists ended up seeing some of the same families over and over for their appointments. And then like the one slide talked about was starting small, we were doing it with our high risk participants at first. So anytime I would open a care plan for a participant, I would continue doing their appointments up until that care plan was closed. So we had kind of already started doing this at some capacity when we got to the learning community. And then once we joined the learning community, we decided to be intentional with this practice and implement this across all 3 sites for all nutritionists to see their same nutritionists or to see their same participants over and over and build that caseload. So at this point, it's been about 2 years now since North Country Family Health Center has fully transitioned into this model and implementing this practice. So like we discussed in some of the earlier slides, you become responsible for your own participants. So some of the highlights for me was that I was handling food package change requests for these participants that I was seeing over and over. So no one else was doing it. I was the one taking on that responsibility of making those food package updates and reissuing benefits. We were responsible for issuing WIC health benefits after the benefits after the WIC health lesson was completed to the participants we were seeing. And then same with any like medical documentation, if we needed a corrected form or something like that, we would reach out to the healthcare provider for our own participants and then follow up with that food package change. So like you heard on the testimonial video, I spoke a few times on there. It's always nice listening to yourself speak in a video you recorded a few years ago, but the things I had talked about in that video still hold true to this point now. You really do get to know these families that you're working with, and they become more than just participants. I joke like sometimes my participants were like my friends. Like I was talking to them every 3 months, and you get to know all about them and their kids and their families and their lives and really build that rapport with them. Some of the highlights with this is that like you certify a brand new baby at this P-Cert appointment, and then you're doing their 1-year recertification a year later as a toddler. So you get to watch them grow all that time from a little tiny infant up into this toddler running around and eating all these different foods and developmenting, learning all these new things. Same thing, I had a mom that I worked with for the longest time. She had 2 toddlers, and then after a few years, she was pregnant again, and I did her P-Cert appointment to bring her back on the program after working with her for a few years with her toddlers. So those are like fun moments. You know, you get to be there with them when they have all these like family changes and they're coming back on the program pregnant and their kids are growing up. And then you feel that sad feeling when they're 5 and aging off the program, and you do the whole exit with them at the graduation. And then as far as like goal setting, like I mentioned in the video, you get invested in the progress with their nutrition goals that they're setting and achieving. You share that excitement with mom when their toddler finally tries a vegetable that they wouldn't eat for like the whole year leading up to it. Or when you have a mom call you who has been trying to breastfeed her baby and having supply issues, they finally call to get all the formula off their food package and switch to fully breastfeeding. Like those are such heartwarming moments, and you feel proud of your participants for working with you to achieve those goals. And then, you know, the job satisfaction really ties into all this because you feel so invested. It's not like you're dreading the day starting out. Like you see those families, those names that you recognize, and you get excited to talk to them and see like a few months later what new things are they gonna share with you today. And then the biggest aha moment, like I said in the video, was a few months after we started implementing our own caseloads. I had a mom call in and ask for me by name to help her with a question that she had about her kid. So that was very cool to hear, you know, oh, they do remember my name. They do know who I am. So there are also benefits with like that work-life balance too, as far as like managing your own schedules If you wanted to take some time off for an upcoming trip, I would have my site lead block my schedule like a few months in advance. So once the line was opened in NIWIC, it was already blocked and there were no appointments that could be scheduled there. If I needed to go to a health appointment, I could call my participants and move them, to a different day and time to block an hour or two in my schedule to run out to go to that appointment. Same with like Chukatele trainings. If I knew there was one coming up that I wanted to join, I could just, shift my schedule around and have that time open to attend the training. We did have this practice too when we had staff call out. I know that someone had mentioned this earlier at the beginning of the presentation. Our staff really got down in this routine of kind of a script we developed in our local agency. If we had a staff member call out for the day, we would have one person reach out to all their appointments on the line and let them know your nutritionist Abby is out sick today. Did you want to reschedule to a different day to talk to her? Or we have another nutritionist with availability that can do your appointment at the same time that you had originally scheduled, kind of giving them that choice. If they did want to keep talking to me, they could just change to a different day, or if they really couldn't, switch their schedule around, that's fine. We had a backup option for them too. There were some obstacles that we came into as well. We'll talk about some obstacles later in the presentation. Staff turnover was a big issue for us at our local agency. We had some nutritionists leave during this time. So if they had given us a far enough advance notice of them leaving the agency, they would work on clearing out their schedules for the future months that were open. So they would, pick the next few days ahead and call their participants on their line and let them know they were moving on to a different job. They were going to be reassigning them to a different nutritionist and just kind of giving them that heads up, like, you won't be speaking to me, Abby, anymore because I'm leaving, but you'll be speaking to maybe Deb next time, and they might be your nutritionist moving forward. So just that they were kind of aware of that too. Because, not only do you get attached to your participants, but your participants start to get attached to you sometimes too, and they, would like to be aware if you're not going to be there anymore when they call in. So I share all of this to say that, building your own caseload, it really does help give you that pride in your job and increase that job satisfaction. But it also helps you understand the importance of your work as a WIC nutritionist. It really places more value on you when your participants want to speak to you, that they have a point of contact at the WIC office, someone they can trust and reach out to. And we've talked about some different ways to start small and grow this practice to make it seem less daunting for you and your agency. And like I said, we'll talk about some challenges coming up a little bit later in the presentation, but I just urge everyone to have an open mind when thinking about this and think about building your own caseloads and consider how many positives this will bring you in the long run.
Great, thank you. We had a couple questions come in the chat so that I want to try to answer. So Rachel asked, how is it managed logistically in NIWIC daily assigned schedules, since NIWIC doesn't allow assigned caseload in the clinic module? I think, Rachel, many agencies would assign a nutritionist to a line. So I might be assigned a line 1 today, and then going forward 3 months, I'm going to put my participants on line 1. Or, some agencies would have the line call Debbie, and then I would schedule in Debbie's line 3 months out. Abby, that's how you guys did it too?
Yes, we named our line, so each nutritionist had their name at the top of the line. So that's something your coordinator would like, or whoever does your schedules to put them into NIWIC. They had to build out a new template in the admin module. So that's something that they would likely be able to understand and get that fixed for your clinic schedule.
Yeah. So those are just some options, and CAI is more than happy to work with any agencies that's willing to or wanting to take this challenge on to work through some of those logistics. But thank you, Abby. Your talk was great. So let's talk about some challenges and some solutions. How to handle missed appointments. So you could offer rescheduling options with the same nutritionist. So when the participant calls in and said, I missed my appointment on Tuesday with Abby, I'd like to reschedule, they can offer to reschedule with Abby. Or they could offer to reschedule with another available nutritionist. And if the participant may lose or maybe be delayed in getting their benefits, you could explain to the participants that benefit issuance may be delayed if they waited for Abby. So we want to give the participant, that option, right? If you would like to see Abby, your benefits will not be good until you see Abby next week. Then for staff turnover, and as you heard Abby talk, her agency had a lot of staff turnover over the last 2 years, but you want to create a system for redistributing participants and how to communicate that change effectively with participants. I know I often get a letter in the mail from my doctor's office that my provider has left and I've been reassigned. I think many of you probably have experienced that. So you want to have a system. You want to talk about that as an agency. So staff should have a script on how to communicate with participants when the regular nutritionist is unavailable. And this, Abby, the script that you just talked about was almost word for word the script, but example is, good morning, I'm calling to inform you that your nutritionist, Erica, is unexpectedly unavailable today. We want to provide you with some alternatives. I can arrange for you to meet with another available nutritionist today, or I can reschedule your appointment for next week when Erica returns to the office. Please let me know what works best for you. And then this often comes up, how to manage participants with complex needs or challenging behaviors. So we think that you should discuss with your coordinator to identify solutions. You could pair that participant with a more experienced staff, or you could refer to a nutritionist that has more expertise with complex needs, such as the breastfeeding coordinator. Those are just some options. All right. So we'd love for you to kind of think through, what would it take to embark on continuity of care in your agency? I'll give you a minute to think about it. You're welcome to unmute yourself. You're welcome to put it into chat. I know there's a couple of you that are in attendance, have done continuity of care at your agency. So we'd love to hear from you. Or maybe I'd love to ask this a different way. Anybody thinking about starting this continuity of care model at their agency? Even if you're thinking about starting small, I'd love to hear from you. All right, I do want to offer some resources. So CAI is available for coaching and support for staff buy-in, scheduling, and improved clinic flow to help achieve this continuity of care at your agency. And we've helped to several agencies over the last couple of years tackle this. I'd love to open it up for some questions, but we've got some questions into chat that I want to try to answer. So Abby, Rachel wrote logistics challenge with call outs. How many appointments are scheduled in each line to allow time for the other tasks that the QN might do? I think some agencies block off time in the schedule. If that nutritionist is also, say, the nutrition coordinator, right? Or I know at one time you did some training, so I know your schedule reflected that. Do you have any
Yes.
more to
So
add? Yeah.
for our agency size, each nutritionist had a caseload of about 12 families a day that we would see. And then as nutrition coordinator, I would receive 1 day at a clinic. So I would do 4 days in clinic for appointments. So I averaged usually about 12 families a day. But it'll, definitely vary by agency size and other responsibilities that you have for the day.
Donna, you're writing that the nutritionists are not always burdened with rescheduling appointments. Intake staff and other support staff help to reschedule participants. Yeah. And then when someone calls in sick, it's not very hard to take over appointments. It's usually just an extra 1 to 2 families per day. Yeah. So it's planned, right? And Rachel, I do know some other agencies have a floater that sometimes steps in if someone calls out sick, or there may be a nutritionist that's in the office that can fill in. It's handled very much like it's handled now when someone calls in sick. And I believe, Abby, your agency, the call-ins decreased when continuity of care started. Staff actually called in a lot less.
Mm-hmm.
So I just want to recap the continuity of care and WIC services ensures consistent support for families, improved health and nutrition outcomes, and enhanced trust. WIC staff experience increased job satisfaction and reduced burnout. Key strategies include effective communication between staff, documentation in NIWIC and notes, and then scheduling within NIWIC to support continuity of care. I want to open it up. Are there questions that we could answer? People love to answer questions.
I'll just add, if you don't mind, no, your notes are better because you're the one that's reading them. You know what you wrote. You're not trying to untangle someone else's words. It's better. You get time to read. You know who you're going to see that day, so you get time to read the notes. You get time to remember, and it's beneficial. It's much more beneficial than just seeing random people.
Yeah, no, thank you, Donna. You're right. And it's just so much easier, right, to pick up where you left off because you're the one who wrote that note.
It is, but in every one of our staff, and we had, I'd say like 6, 7, 8 CPAs, between the 3, Abby would know, between the 3 sites, I think every single one of us said that our, like we felt that the quality of our own work improved and that we felt more fulfilled with our job, so it's worth it to try it. The gentleman in the beginning that didn't feel like he could do it, I really think you could. You should come and visit us and watch. I really think you can. It's just thinking outside the box, really.
And I think too, Donna, your agency, and which is Abby's agency, had all these questions in the beginning, right? Yeah.
They started with just high-risk participants because the QNs are seeing the high-risk participants and they were kind of developing their own caseloads already. So then when we did trainings on continuity of care and decided to do this, it wasn't that much harder. And really, just as you see patients or see participants and you put your name in the alert and that they see me, our alerts specifically say, like mine would say DK, the name of their provider and the date that the consent form was filed. So, and then if they see my name in that alert, they're gonna either try to schedule them to me or to the, if it's gonna go over their BVT date, it'll go to someone else.
Great,
And I just
thank you.
wanted to add to that point too that Donna brought up with the high risk participants. In cases where it's a CPA maybe seeing a high risk participant, what we would do is have a Q1 open the care plan and assign the following appointments back to the CPA to continue that continuity of care. And then if the CPA ever got to a point where they felt like the participant maybe had high needs that they weren't really sure what to say, it became a matter of like just case conferencing between myself as the nutrition coordinator and the CPA and kind of working out a plan so that everyone felt like that they could, you know, handle those higher need situations with a high risk participant.
Great. What other kind of questions? We have such a great resource here today, you know, with Abby and Donna, just feel free to ask a question.
I'll add another little buy-in. So since we started doing this, there's a family that I see and they've been coming every 3 months and they keep coming back. And, you know, and it just kind of dawned on me that I'm the one that's seeing them. They're not coming back. I mean, they're coming back for their benefits. Don't get me wrong. But the fact that they have the option to do it from home or come in, you know, it kind of makes me feel good that they're, even though they know they're going to see me, they know they're going to listen to me, that they're still willing to come in and do that. That's nice.
Yeah. It blew me away how rewarding it was for the nutritionists. We knew participants would like it, but the benefit to the nutrition staff is huge. Yeah. Did someone raise their hand? Because I might have missed it. Anybody? I think Gina, you said your agency is doing this, right? Yep. Any other agency out there working towards this? Because I think it's a great model. Yeah, Jen said getting staff buy-in is the hardest. Yes, staff buy-in, I would say, tends to be the hardest with any change, but we can help you through that. You know, and really, I've asked Abby to speak to many other agencies that have started to tackle this so they can kind of hear how another agency has done it and handled some of the obstacles. I will tell you, working with Abby, I do know that their agencies had quite a bit of turnover with staff, and they were really afraid how this would work when their staff turned over very frequently. Yeah. Janet said she just transferred from another agency and they're doing an amazing job. This sounds like their model. Yep. Anybody else? This was great. We really wanted to really encourage people to think about this. You could start small. You could start it with one site. You could start with high-risk participants. You could start with new participants. You could start with 1 or 2 of your nutritionists. But I really recommend this model. The agencies that have really done this and been intentional about doing this really like it, really enjoy it.